Suddenly you go into your provider and they're saying you need an induction and you're like, and you're not sure what to do. Today, we're going to talk about how to prepare for an unplanned induction, what you can be doing, and what things are going to look like when you get to the hospital. This is a great question because I know a lot of you go into pregnancy thinking there is absolutely no way that I'm going to be induced, but as you continue on your pregnancy, there can be reasons that you need an induction. Really quick, the main big reasons for needing an induction: baby is too big, or baby is too small, too little amniotic fluid, or too much amniotic fluid, preeclampsia, or cholestasis. Those are the main reasons that people might need an unplanned induction, things that show up and we're just surprised that we end up needing an induction. Of course, before we get into it, an induction means that you are not in labor and we are pushing you into labor through medical means. And it's important to learn from an expert, especially somebody who's maybe done like thousands of inductions, which I have. Hello, I'm Hillary. I'm the pregnancy nurse. I've been a nurse since 1997. I have 20 years of labor and delivery experience, and I have done so many inductions. I really am an expert on this topic. I am super glad that you are here. If you want more high quality pregnancy information, follow me so we can hang out for the rest of your pregnancy. Okay, an unplanned induction. Usually you go into the doctor's office and he's looking at a variety of things, labs, how your blood sugars are doing if you're diabetic, other things, symptoms that you have, and they're starting to think that maybe an induction is the best thing for you. Now, the first thing you need to do is in the doctor's office. And if you have skipped that step, your doctor should be willing to talk with you over the phone about these kind of questions. The first one is, why are you being induced? I cannot tell you how many times I would have a patient come into labor and delivery who had a diagnosis for why they were being induced. And I would ask them, why are you being induced? Just so I could kind of understand where they're at with it. And I could use the same terminology that they use. And they would be like, I have no idea, where the doctor just said I needed to have my baby. And that made me sad. I think we should all understand exactly what's going on with our body in basic, simple terms. You don't need to know everything about it. No need to jump into biochem. But understanding why you're having the induction can really help it make sense when you are in the hospital. And again, if you have an unplanned induction, say it's tomorrow morning, and you have no idea why you're being induced, call your provider, call the Nightline, talk with them, because you really need to understand why you're having the induction before you go in. And so many people think my doctor suggested I should be induced, which means I have to be induced. And that's not the case at all. It is always your choice. Now, there are a very few number of cases that are extremely black and white in obstetrics. You really need to be induced. You know, your blood pressure is super high. We're afraid that you're going to seize. That's a reason that you should be induced. Now, your blood pressure and your labs are starting to trend up. At that point in time, you can say, okay, this is super interesting. When are we going to repeat them, right? Could we look at them again? Is there any point in me staying pregnant any longer? What is my cervix? Because it's a real different depending on what your cervix is. So you always have the choice to say yes or no to an induction, even if it feels like you don't, just because the way we term things as providers. I just want you guys to know that you have a choice. You should be talking with your provider. And even if it's the night before and it's scheduled at the hospital, you can still say, you know what? I don't want to have it. Nobody's going to be mad. Please call us and let us know ahead of time, though, because they're going to be staffing to get you into the hospital. And if you're planning on not coming, please let the hospital know. That's a professional courtesy. Now, some of you may have gone in and just were thinking you would like an induction and your provider was like, sure, we can get you on the books tomorrow. Now, that's an elective induction. If there isn't a reason for an induction, it's considered elective. And again, you have a choice. Actually, it is your choice when you have an elective induction. It's not your provider's choice. Now, there might be a reason, like your provider's going on vacation. And if you want to still have that same provider, I think it is totally okay to say, yeah, I would really like you to deliver my baby because we've gotten to know each other and let's get induced. Totally fine. Everybody gets to make their own choice. I'm not saying yes or no about an induction. I just want you to know that it is your choice. Now, in addition to all this, I actually have an induction question checklist that you, again, even if you're being induced in the morning, you can talk with your provider about ahead of time. In this checklist, it's really going to dive into how long they think the induction is going to take, because the number one thing that catches people off guard is how long an induction takes. Inductions can take a really long time. And if you are not prepared for that, 12 hours in, you might be begging for a C-section. And that is absolutely what we don't want at all. We want you to be prepared for what you're going to expect and how you can mitigate those things. Now, one of the ways you can tell how long that induction is likely going to be is a cervical check. Now, I know a lot of people on here are saying they are going to refuse all cervical checks, which 100% up to you. Talk with your provider. But a cervical check can tell us some basic things about how long we think your induction will be. Now, the cervix is at the end of your uterus. It's just the end of your uterus. It's part of your uterus. It's just hanging out here. This is the birth canal that comes in this way, and your cervix is sort of at the top of it. And as baby's head pushes down on the cervix, it starts to open up. And if it hasn't started to open up at all, it means that labor might be a little bit longer than what you had planned. So when your provider checks that cervix, they get a basic idea of how long they think it will be. Now, this is not a crystal ball. It's not telling us exactly how long your labor would be, but it's giving us a good guess. And we actually term it something called the Bishop score, which takes into account how thin your cervix is, how dilated you are, how soft it is, and where the baby's head is positioned in the womb. The Bishop score gives us an idea of how long your labor will be. And I think it's really important to talk with your provider about what they learned from your cervical exam and what they're guessing for how long your induction will be. Your provider has a guess. If they're saying, I absolutely have no idea, they're only saying that to cover their butt because none of us have any idea, right? But they have a guess. In fact, a lot of times they'll schedule you to come in the night before because they don't think you're going to deliver until the next evening. Because of course, providers want to schedule an induction that makes it so they don't have to get up in the middle of the night, which I think you can appreciate. Unless your provider is on 24/7, which some practices are, then they may literally not care. But your provider does have a guess as to how long your induction will be. Again, they don't know how long your induction will be. It is a guess, and that at least gives you something to think about. Okay, the next thing you should talk with your provider about is if they have a guess as to how they are going to induce you. If they are planning on inducing you tomorrow, they should have given an order to the nurse about how they plan to induce you. Are you going to get Cytotec? Are you going to get Cervidil? Or are you going straight to Pitocin because your cervix is already 3 centimeters? Or are they putting a Foley bulb in you? It's important to know these different things. I actually have videos or posts on a lot of these different induction techniques, and I think it's really important to learn about them. I will put them down below. Okay. It's also really important to have a great last meal before you have an induction. A lot of times, especially if you get put directly on Pitocin, they do not let you eat anything other than maybe some soft foods, sometimes some clear liquids. It really depends on your hospital and your provider during that Pitocin induction period. If you're getting started with Cytotec or Cervidil, a lot of times they'll let you eat in the early phases. Unless your provider strictly prohibits you from eating, 100% eat. Now, if you get sent over from the provider's office and like you didn't have time to go home, like it's a real big deal, ask your nurse before they start the medications if you can eat, if they're not going to let you eat once they get started, because food is important, right? So many people don't eat before their induction because they think it's like going in for surgery, and it's not the same. So make sure that you're eating. Pro tip, I would say don't eat like the giant burrito. I would say eat until you're full, but not like over full, because you may end up seeing that food again. And just sitting in a bed with a very full stomach isn't usually the best feeling. This is a great time to finish up that birth class. If you haven't already done it, come join me in the online prenatal class for couples. It actually only takes 3 hours. So if you're sitting there thinking, I don't have time for a birth class, but you still have a few more hours before your induction, you can still get it in. In fact, bring your laptop to the hospital and finish those last 2 chapters while you're being induced, which would take away some of the boredom of being induced. I think it's a great idea. Come join me. Okay, you're also going to want to make sure that hospital bag is packed. I'll put the link down below on what I recommend putting in your hospital bag. At the very least, grab those toiletries that are important to you. We provide toiletries at the hospital, but it's real bad. So I always recommend making sure that you got a toothpaste. If you're planning to like wash your hair or condition your hair or any of those kind of things, bring that. Bring lotion if you're a big lotion user, bring chapstick, and make sure that you have a cell phone charger and a ponytail holder if your hair have of any length at all, unless you have a direct pixie cut. Otherwise, you're really going to want something to pull that hair out of your face. Even my length, I would 100% want something to pull my hair up. The other thing you want to do if you have some time is to prepare for postpartum. Make sure you have some postpartum pads on hand. I recommend Depends for those first few days at home because it is so nice to just bleed on those and not have to worry about leaking onto your sheets because they are so darn absorbent. After you finish those first few days of Depends, you can switch to the night pads and then slowly things will wean off. But make sure that you have some pads at home. It's really going to be helpful versus sending her husband to the store who might be confused and might not want to buy Depends. And if you're being induced tomorrow, make sure that you get some rest. In fact, if you're on the phone with your provider or talking to them, you might even want to consider asking them for something to help you sleep. So many people are nervous before their induction. And if that is you're afraid of not sleeping before your induction, talk with your provider to see if there's anything that they can recommend to help you sleep the night before you get induced. Because if you come in with that full gas tank of actually getting some rest, you are going to be miles ahead. And a lot of times they'll recommend just like a Benadryl or like half a sleeping pill just to kind of get you that rest that you need. Pro tip, let's say you're getting induced the night before, you can actually ask your nurse in the hospital if they have anything ordered to help you sleep, because again, we can fill up that gas tank of sleep in the hospital. And if you do that, hopefully your nurse will leave you alone for a few hours so you actually get some rest, because the hospital is not well known for giving you a lot of rest. Let me give you a few don'ts to do. Don't worry that your induction is going to be so miserable. I know that the day before my induction, I cried the entire day. It was completely useless. Induction went totally fine. It was great. Have no regrets for getting that induction, but I wasted that entire day when I could have been eating frozen yogurt and just watching some favorite TV shows by myself. Again, like I said, don't eat a giant meal before coming in, and don't let your provider make the choice to be induced for you. It is always your choice to be induced, not theirs. It doesn't mean that there aren't a lot of good reasons to be induced, but it is your choice, not theirs. I hope before you go in to get an induction that you have taken a birth class. I think if you are being induced, it is an extra good reason to make sure that you've taken a birth class, just because you're going to have more questions and choices to make. And when you learn from a provider, it really helps you to make those choices on your own. Okay, when is your induction? Tell me down in the comments. It would be fun to start a conversation down there. Thanks for joining me here on The Pregnancy Nurse. Please give me a follow so that we can hang out for the rest of your pregnancy. And please like this video. It really helps other families find high quality pregnancy content for their upcoming hospital birth.